Hello everyone, welcome back. It's Friday. You know it's Facebook Friday time here at Chiropractic Company, and we're happy to have you. You've successfully managed to make it through your entire work week, so now you get to sit back and watch us talk to you about a little bit of a couple health-related topics. Today we've got a pretty interesting topic. Once again, I find them all to be interesting, so you're going to hear me say that a lot. But one of them really ties into some of the things that you might not know about Chiropractic Company. Today we're going to be talking a little bit about sports injuries. Why are we talking about sports injuries? Well, many of you don't know that Chiropractic Company is actually the official doctors for UWM athletics. You'll find that all of the players are getting adjusted by Chiropractic Company doctors, which is a pretty neat deal. We've been doing this for a couple of years now, and we've got several partnerships with other schools and programs throughout Greater Milwaukee. Many of you know that myself and Dr. Botros and some of the other doctors have worked with numerous professional athletes. So today we figured let's talk a little bit about sports injuries. So most of the time when we talk to patients in the office, we're talking a lot about pain and some of the symptoms that they have. But when we work with sports injuries, it's slightly different. There's obviously some things that we work with as far as pain management is concerned to be able to get the athlete back on the field. But many athletes that we take care of, we don't necessarily only function our goals around how they feel. We really get to the root of what they're doing on the field and how they're performing on the field. So a lot of these athletes are coming in for performance care rather than just for pain care, because they want to make sure that they're able to stay on the field and perform at their optimum. In previous videos, we talked about different injuries and types of injuries that can occur and some of the characteristics of what causes an injury. And so Dr. Botros and I are going to talk to you a little bit about that coming up here. But one of them that we always want to make sure that we talk about is that the leading cause or the leading indicator that an athlete is going to get injured is a previous injury. So if we can prevent injuries from happening in the first place, it really will go a long way with keeping them on the field and working at their optimum. Dr. Botros, talk to us a little bit about some sports injuries.
So one of the more common sports injuries that we see is actually related to your muscular system. And the muscles that we train, whether we're performing as athletes, playing basketball or running or wrestling, or just whatever activity that we need to do, are actually called skeletal muscles. And the reason they're called that is because these muscles, even if you're weightlifting, they attach to your skeletal system, including your spine and your hips and your low back and your neck and all of these vertebrae that you have. And so keeping that in mind, it's really important to make sure that for the muscles to be balanced with each other, that the joints are moving properly and things are in their proper alignment so that they can fire sequentially with each other to complement a fluid functional movement as opposed to rigid movement that are more likely to cause injuries. And so we see with a lot of athletes that, we see that muscles can get injured and joints as well if you overuse it, or if you misuse it, or again, as I stated earlier, if the muscles are imbalanced with each other, where one group of muscles is working a lot harder than another set of muscles, and this can lead to imbalances and injuries. Interestingly enough, there's a study that came out a few years ago that found that when people get adjusted, their reflexes improved drastically. Now, this is really, really important because reflexes, especially involuntary reflexes, are actually what protects us from harm and injury when we're doing any kind of movement. And so if you've ever been to a doctor and you're sitting down and they take a little hammer and they hit your knee and then you involuntary kick, that's that reflex. And so we want to make sure our reflexes are really sharp and really dialed in, because that tells us that the brain muscle connection is very healthy and the communication between those two, which is through the nervous system, is functioning at its best. And when we can do that, just as we talked about in an earlier video about balance, our muscles, everything functions well with each other, and that can actually help reduce cases of injuries from happening in the future.
So let's break that down just a little bit so that people can understand that a little bit better. So let's think of a baseball player throwing a ball. To get the optimum speed, your arm acts as a whip where there's kinetic energy that goes from one part to the next, and they all have to connect to make this whip as strong as possible as the pitcher releases the ball. Think of if you're going to try to crack a whip, and to get it to crack, you have to get this whipping motion and snap, and then it goes and makes that loud sound. Well, let's say you take it and stop and stop and stop and stop and stop and stop. What kind of a crack are you going to get at the very end of that whip? You're not going to get very much. But this is exactly what happens when your muscles are imbalanced, is that as they contract, they don't contract fully, or they're already in a state of overcontraction. You're telling them to contract even more, and they just simply can't do that. And so if we can align all the tissue up and get it to move in smooth formations, then you'll be able to create that smooth whip, which once again gets you to function at your optimum. When these muscles are imbalanced and there's all that tension and there's stop, 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 they're much more likely to get injured as well. We talked about this in a previous video as well, where those muscles are just going to continue to get injured because you're recruiting them, putting load on that muscle, and they're just unable to fire properly. Muscles, as we always say, attach to bones. So when the bones are misaligned, the muscle has a much higher problem rate and much more likely to get injured. Another great study was done with Australian rules football, and they took a whole bunch of these athletes and they took control and said, we're not going to adjust these players, but we are going to adjust these players and see what happens. And guess what happened? The ones that were getting adjusted were far less likely to get injured. So once again, great studies out there that say, get your body tuned up, get it prepared for the activity, and it'll function like it's supposed to.
Now, there are interesting studies too that show, like for example, if you are an athlete and you did get injured, should you get adjusted?
It's a great question.
And the answer is yes, absolutely. So we found that not just in our clinical experience, but through data and research, found that when you do get adjusted, when you are injured, you can increase your recovery rate by almost a third, which is phenomenal. So especially if you're a professional athlete or someone who really, needs to exercise to burn off their stress and stay healthy and have well-being, if you can shave that time by a third, that can make a world of a difference. And so you can get back with the momentum of exercise and performance as well.
As we know, once again, athletes are always looking for that extra inch, that extra yard, just that extra little edge to get them ahead of the competition. This is a great opportunity for you guys to do that. Once again, take care of your body, get it prepared, and when you do, great things will happen on the field. All right, so that's what we have for you today for Facebook Friday. Any other things about sports injuries that we need to know?
Maybe in a part 2.
We'll talk about potentially in a part 2. If you have questions about it, let us know, and we'll be able to address that in our next video. If you do have questions and want to contact us directly, once again, you can do it through our Facebook page, or you can call us at the office, 414-332-0859. Once again, I'm Dr. Alan Van Scoik, joined with Dr. Botros, and we'll see you next week on our Facebook Friday.